is Motalatale from the Health Department. Thank you so much for your time. Can you just give us a sense of what the turnout has been like here at Atteridgeville?
Thank you, Rosan. I think what we need to say is that we are quite pleased with how the public has responded. The vaccination site that we're at now is a site that has started operating over the weekend only this week. So it means Tshwane now has 8 vaccination sites, public vaccination sites that are opening over the weekend. They all opened this weekend. And so far by midday at this site in particular, we had already vaccinated 140 people. And I know that at other sites as well, the numbers are looking quite good. I mean, at President Hyper at the Sidibeng, one of the sites at Sidibeng district, they were telling us that by midday as well, they had already done over 160 vaccinations. So this demonstrates to us, especially given that today is part of month end, the way people have been able to come out, even though it's month end, it says there is demand for vaccination. We just need to ensure that there's consistency in terms of the sites continuing to operate, to offer everyone a chance in terms of being able to vaccinate over the weekend.
Let's talk about the drive-in vaccinations. I mean, earlier you told me that these are already operating. Where in the province are they operating and how?
We have various drive-through sites. We have drive-through sites in Joburg, in Bara in particular, and then also at Gauteng. We have another site in Ekurhuleni, actually 2 sites in Ekurhuleni, at the Davidson Main Clinic, and also at the Christian Family Church in Boksburg. So the plan is to increase the sites at strategic locations across all the districts. I know that this one is currently working on also opening up 1 or 2 drive-through sites. How it works is that the drive-through sites are linked to a particular site where people can walk in, as you have seen here, and then others that want to get vaccinated at the comfort of their own vehicles, they then get queued and they get vaccinated while they are in their vehicles. And the whole process from screening up to you get your vaccine, you get observed, and then you leave. It happens while you are in the comfort of your car. What is happening is that we are seeing people also bringing their families and friends and colleagues to the sites, and which is what we want to see. So we are actually availing a diversity of options that people can be able to use to vaccinate.
So now, how is the department encouraging people to actually come out and vaccinate? You know, what initiatives are you undertaking? Or are you just sort of kind of depending on word of mouth?
No. There's actually various strategies that are at play. We've got a team that deals with social mobilization. That team is the team that is going on the ground to communities, and they actually do campaigns where they spread the word, they do loud hailing, they engage with communities using local media. Even now, your presence as ENCA being here today is part of the drive of actually encouraging people to come through and get vaccinated, because the media has played quite a critical role in terms of actually encouraging and sending out good messages that are actually informing the public of where the vaccination drive is happening. So we've got various means. We're utilizing all our platforms as government across from local, provincial and national. You go to our social media platforms, you go to our websites, you go to the various WhatsApp groups that are there in community. So every possible avenues. I know that municipalities like Tshwane, where we are now, they are also even utilizing their monthly bills statements when they send to residents to actually communicate the messages about the vaccination drive. So there is a host of measures that are being employed. We've got also partners with development partners like your UNICEF, who have also availed some of their resources, like your mobile trucks that are going to communities, and they actually share messages to encourage people to actually participate in the program.
Thank you so much. Well, there you have it, Ms. Negi. You can hear how government's efforts rather to encourage people to vaccinate